There are concerns for premature babies and newborns after a COVID scare at one of Melbourne's major hospitals. Melissa Christides joins us live now. And Mel, vulnerable patients have been exposed to the virus.
Very concerning, Laura. 29 of the state's most vulnerable patients have been exposed to 19 after a patient with COVID-19 unwillingly entered the Royal Children's Hospital's neo-natal intensive care unit. So that unit has been closed for deep cleaning with everybody there now in isolation. There are currently 50 parents and carers there undergoing isolation. But concerningly, several parents that have visited this hospital over the last few weeks have tested positive to the virus. It just shows you the immense strain our hospital systems are dealing with COVID-19 here in Victoria. There are currently over 600 patients with COVID-19 in our hospital systems, with experts warning that that number is predicted to grow. We are going to reach our peak of hospitalisations here in the next few weeks. The government yesterday announced that they are sending over an additional 1,000 hospital staff members, GPs, nurses and midwives to help bolster our frontline healthcare workers here in the state. Now, with regards to the Royal Children's Hospital, they have now introduced mandatory rapid antigen testing for any visitor that enters the premise, but some say it should have been implemented much earlier.
That scare could have been averted if rapid testing had been in place. It should have been and could have been in place to avert such a scare.
We introduced visitor restrictions earlier than the CHO directions. We have more stringent infection prevention and control processes in place quite early, but as the numbers have expanded in the community, the risk has gone up, and so I'm really pleased that we are implementing it this week.
Mel, it's certainly a concerning development there in Melbourne with so many vulnerable patients being exposed, but it seems like the case numbers have stabilised a little bit over the last couple of days.
Slightly so, Laura. So 1,571 cases recorded over the past 24 hours, but sadly 13 deaths have been recorded in the state. That's our biggest death toll seen in the last 12 months. So we've seen numbers relatively on a downward decline over the last 5 days. We saw them peak at the almost 2,000 mark recently. So we did ask the Chief Health Officer yesterday whether this does mean that we have reached the peak of the pandemic and cases are on that downward trend, but he's taking a very cautiously optimistic approach and will not commit to that. He wants to track case numbers over the next week or so to see how the state is tracking. But vaccination uptake is on the rise, so that's good news there.
I'm cautiously optimistic, like many people. To have 4 days in a row of decreasing numbers is a good trend, but it's not definitive. We can see numbers bounce around and we can see behavioural changes change the numbers a few days later.
Now, Laura, we are on track to meet our vaccination targets, but we'll have to keep our eye on case numbers to see if we can start to reopen the state come late October. Laura?